Welcome to Read This, Author's Corner. I am your host, Alice James, and today I have the pleasure of speaking with Dr. Melanie McCloud, the author of Black Women's Wellness. Welcome, Dr. McCloud. Thank you so much for being on Read This. I am so excited about your book, Black Women's Wellness, right?
Yes.
That I have to ask, what inspired this? Because you have made me so very happy. I haven't been this happy since I was like a teenager and I got our bodies ourselves and got to learn what it meant to be a female.
Mhm.
And I have never seen anything that was just targeted to Black women. So please share. Before you share about the book, please tell me a little bit about yourself.
Well, first of all, thank you so much, Miss Alice James, for having me. I appreciate it. I'm glad to be with you and the network, and again, I'm just happy to be here and honored to be here. Uh, First, a little bit about myself. I'm actually a native of New York, and then I went to school in Boston. I grew up very poor. I never knew any of my grandparents at all. I had an absentee father who I later found and met when I was 49 years old. That was culture shock. And I was raised by my mother, who did the best she could in the early years. And then later, actually, I realized that she had some issues going on, but lived in a sixth floor walk up building on the fifth floor of that.
Wow.
But, and there were drugs in my community, but thank God I was able to get out of that unscathed. I never did anything. Um, and I was blessed to, believe it or not, at that time back then, actually have a Black female pediatrician, which I think, might
Wow.
have been a visual for me, which, maybe we can get to that later. And then I went to school in Boston, at Boston University, and Boston University School of Medicine. And then I came to Emory to train and set up a practice. And now I'm doing public speaking and writing. So that's me in a nutshell.
Right.
um, Thank you for your kind words about the book, because you're right. There are other books that are written out there, but hardly any of them really speak specifically and directly to us as Black women. And I give information, of course, about Black men, but I do include with information about everybody: Black, white,
Right.
Hispanic, Asian, and Native American women. But there really has not been. In 1994, Linda Villarosa wrote a book, Body and Soul, and actually I was a consultant on that. But there hasn't been much, especially one written by a physician authored.
Right.
So
Yes.
I thought it was timely. Um, when you look at other health books, rarely do we get a sentence,
Yeah, honorable
certainly
mention.
not a paragraph, and certainly not even a chapter. So it was time for us to have a book about us, given healthcare disparities.
Right. When you hear that African Americans have a higher incident of this thing and that thing and the other thing, and I'm like, well, why aren't we studying why?
Mhm.
Why do, I in my mind, it's unacceptable for 20, 30 years later to still have the same explanation. We have it, and there's no, well, this is the reasons, or this is how we're working on correcting it.
Mhm.
So um just being able to see someone take the time to identify, this is us, this is how things affect us, has really lifted my heart, that we'll get more of this and we'll get answers instead of just a blanket statement. So please, what was the motivation for creating this baby?
Yes, and it took even more than 9 months for this baby to come forth. For one, I was writing this during the whole COVID time, so I personally even was having some what we call languishing. We were all in a fog
Right.
mentally, and also data. COVID was affecting a lot of the data that we had available. So I mean, I've written this book twice, really, two and a half times, quite honestly, because the data kept changing and all that. But again, I saw that there was a need, and also because we do keep hearing the same thing. We keep hearing that and these things are legitimate that why do blacks fare less favorably than other people? What is it? What is the
What are
situation?
they
And
doing wrong?
yeah, and we hear that for one, blacks may have less access to medical services, and which may be true, which is true in many instances, or we may have less medical insurance, which is often related to job security and what type job you have, and some jobs don't provide medical insurance. So those things are true for many, 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 many people. But the issue is that even for people, and in particular Black women, with access to medical care and with medical insurance, we still lag very, very, very far behind when it comes to successful healthcare outcomes. So, what is the reason for that? And in the book, one of the reasons I give, which is a key thing of why I wrote the book too, is what else is it? What's causing it? Because when we're born, provided our anatomy and physiology is normal, we are all the same regardless of our race. I mean, we may have different complexions, we may have different hair, but we are all genetically and anatomically, the ovaries are where they are, everything is where it is when normal. Okay, so what's the difference? So one thing that I noticed was what I call the psychosocial factor, the social stress that we as Black women predominantly experience. The negative media imaging that's put upon us, the colorism issues that we still deal with the light skin versus the brown skin. That still is happening, especially here in the South where I live. Um, we are the least married demographic of all women. We hear lyrics, unfortunately, sung to us. I don't listen to that music, but sung to us mostly by Black men, where they're talking disparagingly about Black women or women in particular. So all that is coming at us, and even when we succeed in careers, sometimes our achievements are minimized, or we're aggressive, or when we're really just studying, just doing what everybody else is doing. So I put all that together in a chart: societal stress, and Black women's health, the rejection connection. So I think that plays a role, because those stressors on our mind affect our heart with cortisol levels and stress hormones and hypertension and obesity, and all that leads to diabetes, and then that leads to heart disease, and then that can take us on out. So I think that's one factor.
And I think that's a very good point call out, because I know, my parents worked two jobs, and my dad used to have the saying, like, you sleep when you're dead. But I didn't recognize if you don't sleep, you'll be dead a lot faster.
Sleep is very important. It is
Right.
very important.
But when you grow up, and to your point of the stressors, in order for us, quite often, to achieve the levels that we want to achieve, you have to work twice as hard. You walk this fine line of not wanting to make a mistake. Like, anyone else can make that mistake, and it's just like, okay, well,
Yeah.
mistakes happen,
But
pencils
if
have
but if we make the mistake,
but if we make a mistake, it's
we're not
all
qualified. How do we get that
exactly
job? How do we get into that school?
right.
You just got in because of affirmative action, or you didn't really deserve to be here. So yeah,
Right.
all that stuff. And you're right, we do have to walk. We There's this expectation that we do have to walk straighter, and everything. We have a saying even in medical school years ago. It's like you have to even be better. Not even that, but everywhere you have to even be better than some folks to look like you at least are equal.
Exactly. Exactly. And that's in pretty much any profession, that you're coming into. And if you're the first, and believe it or not, in this day and age, we're still being the first in so many places.
I was a
To
first here in my community as far as
Yeah,
an OBGYN to set up an OBGYN practice. And that was years ago, but we are still first happening at this
first.
time, which is
Right. So that comes with its own stress. So I thought that was an excellent call out that you had in there, that we do have all of these other stressors. And even for me, I've always had a good job and a decent income, which it gave me access to good health care, but it was still, what I was going through was minimized. And when you don't know, you don't really know how to advocate for yourself. And that's what one of the things that I'm happy about this book is because you give understanding of things that women can help women advocate for themselves.
Well, and that's another reason. There were many reasons why I wrote this book. One, there wasn't a book out there for us. Two, I know that despite the challenges that we face or what has been the history of our health, I know that we can do this. That's why I kind of, I've got this. We can change. We can take some steps to try to improve our healthcare outcomes. And I want people to first know that knowledge is power. You need to have some knowledge. And one, yes, the book can serve as part of that knowledge, part of that resource for you to have. Also, I begin the book first giving honor to some medical pioneers and other Black women who have gone on before, not only in medicine, but in science and research and things
Mhm.
like that. But also in the beginning, I start out with knowing your family medical history because you need
Right.
to know what you are coming to the table with from the get-go. Okay. What did grandma have and mommy and daddy have? Was there a family history of diabetes, a family history of heart attacks at 35 or 40?
Mhm.
Is there a family history of sarcoidosis or something like that, or asthma, cancers? What type of cancers? There are genetic reasons for some cancers. So one, I start out with a nice little checklist with
Right.
conditions and then family relations to check, 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 check. So that's the baseline. And then I basically cover pretty much, I mean, there are hundreds of medical conditions, but I really covered a good number of them.
Mhm.
Really, I start out with medicine's top five with heart disease and obesity, diabetes, and maternal mortality, cancers, and then, of course, HIV, AIDS. But then I also get into arthritic conditions and eye conditions and lung conditions. And then we get into some other stuff. So that's one reason. And I also give women encouragement of what to do. And getting back to one of the things that why there's a disparity is we also did not participate in clinical trials as we should. And actually, I don't know if you can see this, but actually, there's a group that specializes it's the Center
Okay.
for Information and Study on Clinical Research Participation. Okay.
Mhm.
And I saw them at a conference a couple of weeks ago, and I spoke Saturday and had asked them to give me some brochures. And they talk about some of the myths about clinical trials and also how it's important for more Blacks to participate in clinical trials. Now, I realize that may touch on some tender spots because in years ago with Tuskegee and things like that, we do have a hesitancy about what the medical community may be doing to us. There are some racial differences with particular tests and all that. And that's why now it is important for us to be more active with participation in clinical trials, just so we can pick out what else are those differences that we may have genetically that can better our healthcare outcomes.
Well, it's interesting you say that because I was watching BBC News maybe about a year or two ago, and the rate of breast cancer is on the rise in China, and the anchor was asking the Chinese research doctor, she goes, so are you going to take the Western medicine and utilize those? Are you now utilizing Western medicine in China? And the lady said, no,
Mm.
we are we are researching what is being used in the West and we're testing to see what works for us.
Some genetic things that run in our ethnic code. And I'm glad to see that we are paying more attention to that and that scientists are paying more attention. There's more attention being paid to that. But also, too, I want people to be their own advocate when going to the doctor. Again, paying attention to what your body is doing. I mean, you know how you feel when you feel good and you know something's not right. And sometimes we hide, we don't want to go. Um,
Mhm.
we can't always hide. We can't only pray about some things because, we're like, I'm just going to pray about it. But, I pray too. But you know what? We need to go ahead and go to the doctor and get ourselves checked. So let physicians, let us be part of your plan. It's like, okay, God made us be able to have the minds to do that. So make use of that. Just
No, trust me, I know when I was originally diagnosed with sarcoidosis and people like, oh, don't claim it. I'm like, I can't breathe. How do
my God, girl, listen, you said, this is what I talk about too. I have asthma. I did not get asthma when I was a child. I got it when I was 40 years old. Okay. And
I
at
got it 10
first,
years ago at 58.
when I first came down with the asthma, and at first I even misdiagnosed myself, quite honestly. I was like, do I have pneumonia? Do I have bronchitis? I had my nurse plant the tuberculin test on me. Like, what is it? It was like, well, let me get this checked out. And the whole thing was asthma. I don't want asthma. I'm not claiming that. I'm not claiming I have asthma. But you know what? My name is Dr. Melody McCloud, and I am an asthmatic, because if I don't act like I have asthma and I get an asthma attack where I cannot breathe, I could die.
I tell people that my sarcoidosis is God's brakes, because I don't know how to put on brakes.
Really, God, not right now. I ain't got time. But it's like he has like, well, that's just too daggone bad.
Brakes. Yeah, I say slow down.
That's a good way to put it. I'm gonna have to remember that. That's a good way to put it.
He starts pumping the brakes. I feel like this book is important to have, not for you to self-diagnose, but for you to see that there might be symptoms here that you're having, and you can ask a question about something that no one else might ever bring up to you.
And that's why, actually, again, in the front of the book, I have the family medical history
Right.
checklist, but in the back of the book, I actually have
Health questions.
a
Yeah.
health questionnaire.
Right.
Okay, for you yourself, after you've read some of the book. And and I don't expect everyone to read a medically health related book cover to cover necessarily.
Right.
I mean, that'd be great. But you may see a condition that you know about or think about, or someone in the family has, or whatever. But in the back of the book with the health questionnaire, I have pages of check things by your system. Just check your skin, check your eyes, examine your breast. How's your breathing? What about do you have joint pain? What about your vision? So check off, check, and then take that.
Exactly. But prior to my diagnosis with sarcoidosis, I couldn't breathe. Went to urgent care. They thought I had pneumonia. I was treated for pneumonia for 6 months. To the doctor, I would give him this list of stuff that was happening to me, and I couldn't figure out. And I was going to specialists because I was having all these nosebleeds and all this stuff happening. And he literally asked me, what does that have to do with pneumonia? I remember telling him all these things, and it wasn't until I got uveitis in both eyes. Almost lost my sight in both eyes. The ophthalmologist called him and said, this woman has some sort of autoimmune condition. Have you tested her for autoimmune condition? One of the things that I have learned from that experience is that you do have to advocate for yourself, and you do have to ensure that you're heard. And I think, and I share that because I know for myself at that time, I just assumed that the doctor knew more than me. And when he asked me, what does that have to do with this? I thought it was all in my mind, or I felt like I was making something up.
Yeah, no, in fact, that reminds me, if I may, years ago, a friend of mine, I'll never forget. In fact, in the book, I used some pearls of wisdom about relationships, and I applied to physical healing. And one of them I brought forward because of him. And one is, it is never underestimate how much someone hurts. But what the physical part, he told me later, he said, I kept going to the doctor because I had this pain in my neck, and they just thought it was a muscle pull or strain or whatever. And he finally, after a few months, kind of like your story, a few months, finally someone ordered a CT scan, and they actually found a mass in his neck that turned out to be lymphoma. And unfortunately, after he didn't live long after that, but he kept going for about 4 or 5, 6 months, complaining about this pain, where you don't know what should or should not be checked. So I tell people, if you've got a medically educated person that you can trust, maybe take them with you to the doctor. Maybe they may hear something that you don't hear, or they'll have one, and hopefully the doctor is smart enough to realize to, look at it and see what's what. But you have to speak up for yourself. You have to ask questions, and don't let them rush you out of the office right now, because insurance companies are trying to run everything. And you as a patient, you have to be your strongest advocate and get someone to go there and be there with you if necessary.
That's and I so agree with that, because when I think back at the fact that when you're really sick,
You're not really, you might be in a whole, and God forbid if you hear the word cancer, I mean, you just hear that word and you just totally zone out. Your whole life flashes before you, and everything. Oh my God, my kids, my husband, what am I going to do? What about that? Just to hear the word. So if you hear something like that, or if you go back for the consultation, yeah, I encourage people to take somebody with them that can also hear uh with a different ear than what you may or may not hear. That's real, real, real important.
that's and I want to get to, especially since you're OBGYN, I want to get to a conversation. Let's talk about sex as in your book, just because I think that there aren't very many intelligent conversations about sex.
Okay.
You know,
Yeah, it's either the raunchy kind or it's the forbidden, we don't talk about it at all kind.
exactly.
Yeah, I wanted to include sex in the health book because it's a part of who we are,
Exactly.
as men and as women.
Right.
We are physical beings, and the activity of our limbs and things like that. We are emotional. We have feelings about this, that, or the other. We have maybe professional goals. Most women have maternal instincts. But also too, we are also sexual beings. I mean, none of us got here, quite honestly, without sex being attempted at some point in time. And and it happened, I
Yeah.
mean, even if people were born by, artificial insemination later on, at some point, somebody was trying to kick it at some point to get it together. Okay. Male sperm, female egg, boom, boom. That's how
Yeah.
that's just the way it goes. Okay. I mean,
Right.
people, okay. But so we can't deny that that's a part of who we are. And that's who God made us. I mean, that's how we
Exactly.
are made. So, that's how we have, 8 billion people on the earth. Okay. This is just a part of
Exactly.
natural life. And there are some health benefits to sex. It's good for your heart. If you're getting it right, it's good exercise. Do you want to be on a treadmill or you want to be having a little bit of fun? Okay. It reduces chronic pain. You sleep better at night if you're having, sex that's good. It extends longevity, believe it or not. So there are many health benefits to good, healthy sex in a healthy relationship.
Right.
And of course, too, we have to watch out. And I give the good, the bad, and the ugly about
Yes,
sex.
you do.
Yes,
You
I
do.
do.
Yes,
And
you do.
so the good part again, it's a wonderful thing. Sex is great. It feels good. Hey, you got your sweetie and if it's an act of love, I mean, it's just a good sharing and coming together of two people,
Mhm.
sharing with each other. But of course, I encourage women, and I'd be remiss as an OBGYN to not address the STDs that can happen, which are still out there. People don't talk about STDs as much as we need to, but gonorrhea, chlamydia, syphilis, all that herpes is still popping. And of course, HIV/AIDS is still popping. And that's a critical issue. And that really has a lot to do, especially with heterosexual women who are having sex with high risk men,
Mhm.
who quite honestly, though, most of those high risk men are what we call on the down low because they're not telling the women that they go both ways. So that's a
Right.
crisis that has to be addressed. But
Mhm.
also, too, women can, we can talk about that more if you want. But there are also times where some of us have been taught, that sex, is a no or you can't do that, and also that psychological stress of that can
Right.
affect your attitude about sex.
Mhm.
You may feel that it's dirty or you're not supposed to do this, or and there may be reasons why you may not feel like doing it. There's female sexual arousal disorder. You
Mm.
may want to have sex and someone's trying to have you a good time, but you're not getting aroused.
Mhm.
Okay, something's not happening.
You covered the benefits and the sexual dysfunction. And let's talk a little bit about menopause, because we're kind of brainwashed as women to be kind of like unhappy with every stage that we're in. Oh my God, yeah, we have our periods. Oh, how horrible this happens every week. And then, and then when you get to about to go through menopause, oh, you're gonna go, you're all dried up. It's like there's what is good, what is supposed to be good for us. When is there a good time? I absolutely love menopause. I have no
Well, the thing about menopause is, years ago, menopause was kind of really looked down terribly. Oh, the woman's going into menopause, put her out to pasture. She's no
yes,
good. She's dying. And you have to admit too, menopause, uh, the average age is 51.2 years on average. Okay. Some people go through earlier, some people go through later. Um, but and two, life expectancy years ago was a lot less. So not because of menopause, but just because our life expectancy was less.
right,
If a woman was going through menopause at 50 years of age and the life expectancy at that time was 60 or whatever,
right,
in her mind or her husband's mind or whatever, okay, well, she's got this, so she only has a few more years left to live. But see, that's not the case nowadays. We
right,
have much longer life expectancy, thank goodness. And now we have learned too that menopause is just a natural part of our womanly progression. Okay. The estrogen does go away, it stops. You will get some hot flashes or night sweats or whatever. We have ways of managing that. But truthfully, I'm enjoying myself. I enjoy menopause. You don't have to worry about monthly activities every time. You don't have a risk of getting unwanted pregnancies. You're saving money at the drugstore buying supplies. You don't have those accidents that could happen. So menopause. But basically, all things being equal, again, the average age of a normal physiologic menopause is around 51.28 2 years. Maybe 48, 49, people might start having some
mhm.
mild symptoms, but 51 or so is really with the cutoff. I actually went through late. So I was like, okay, when is this going to be over? And one other thing about menopause, we consider you having really gone through the active menopause phase when you have gone a full year without having any bleeding whatsoever. Okay. And if you do that one full year with no bleeding at all, and then you have any bleeding after that, that really can be a matter of concern, and you need to get that checked out.
Thank you
And
so
kudos to Pauletta Washington, Denzel Washington's wife,
yes,
gave me an endorsement. Dr. Jen Ashton of Good Morning America.
knowledge to go forth and be
Thank
healthy.
you. Thank you so much for having me. I really appreciate this. Welcome to come back again sometime.
Thank you for joining Read This. And don't forget to pick up a copy of Black Women's Wellness by Dr. Melanie McCloud. Until next time, see